Hi guys, welcome back to my channel Mom's Time. The viral fever season is upon us. That's why I made my last video on antibiotics. Today's topic is fever control. A fever is a body's natural response to an infection. It is not an illness per se, more like a defense mechanism as well as a symptom. We have a thermostat in our brain that maintains our body temperature in a very narrow range. So when that set point of the thermostat is raised, that's when our body heats up and we get a fever. Get this, it's very different from a heat stroke or sunstroke. In cases of heat stroke, the body's natural thermostat is not touched. From an external source, our body temperature is going up. So that needs to be taken care of immediately. But today I'm not going to be talking about treating fever. As I said, fever is not an illness. It is a symptom. It is a defense mechanism. The illness that we actually have is fever phobia. How we go running to the doctors or reaching out for crocin and Calpol and ibugesic when our child gets fever. Being scared of fever as a symptom, especially when our kids get it, that's what needs to be treated. There are so many benefits of fever. The higher temperature stops the multiplication of the virus and bacteria, which require a specific range of temperature to grow properly. The fever in itself stimulates the production of white blood cells in the body. The fever primes the bacteria or the virus to be killed better by the white blood cells. If antibiotics were to be prescribed to your child for whatever reason, fever along with antibiotics has been proven to be better at eliminating the infection than antibiotics alone. All these beneficial effects reduce the length of the illness in your child by a day or two. Do not regard temperatures of 99 and 100 as fever. If the child's temperature is over 100.4, that is your fever. The best way to check a child's temperature is rectal, but it is not feasible, it is not acceptable, it is not comfortable, and it is definitely not easy. So axillary temperature, where you check the child's temperature from the armpit, that works best. If you check your child's temperature in the axilla, do not add a degree and tell your doctor. We are trained to do that. It comes naturally to us. So if you add a degree and we add a degree, we have 2 degrees more. So am I saying you never treat a fever? No, I'm not saying that. Please, I'm not. Don't treat temperatures of 99 and 100, as I said. If at 101 also your child is active, eating moderately, he won't be able to eat as much. If he's eating moderately, he's a little active, playing, not on the bed the whole time, let that run its course. The times you take your child's fever seriously are if the child is less than 3 months old, do not hesitate in immediately taking him to the doctor. He needs a thorough evaluation. If the child is vomiting non-stop, not able to breastfeed, not able to take any fluids, take him to the doctor. If the child has neck stiffness. Now, how do you check neck stiffness? You don't push the child's head down. It's not going to work. The child will resist it. You can just point to his chest and say, hey, see what's there. And if the child is not able to touch his chin to his chest to look down, need to get evaluation for meningitis or something. If your child has more than 5 days of fever, go see the doctor. If the child is too sick, too lethargic, not able to move, not able to get up to feed, then you can visit the doctor. If your child has a chronic problem like a heart condition or a lung condition, fever puts a lot of stress on the body's limited energy reserves. You should see the doctor and you should control the fever in such a child. Normally, viral fevers can be accompanied by a simple rash, which does not need to be taken seriously. But a meningococcal rash is a more sinister problem. So any rash, just get it evaluated. If the child is tugging at his ear and crying, then that could be a hint at ear infection and you need to get him checked. If you see your child who is wearing diapers, he just randomly cries and then stops on his own, think of a urine infection. Maybe he just passed urine in his diaper and you didn't realize it. Or if the child is a little bigger and he goes to the bathroom while passing urine, he cries or he's scared to go to the bathroom because of the pain that he gets, think of a urine infection. High fever will not cause brain damage in your kids. It's a myth. Especially children who are prone to fits during a fever. This is called febrile seizures. Such children at a much lower temperature like 100 or 101 degrees, they'll get the seizure. And your doctor will often prescribe anti-epileptics and will give you a regimen to follow. Another myth floating around in the parent community is alternating fever medication for better effect and less side effect. Less side effect has not been proven by conclusive studies. The jury is still out on that one. Alternating fever medication makes sense when the doctor is doing it for maybe like an admitted patient or a patient of fits and he gave paracetamol at a certain time and it did not have its effect. So maybe 3 hours later, the doctor can alternate it with ibuprofen. If you're sitting at home and a child is running a fever of 101, you gave him paracetamol, it came down to 99.5. and then you decide, oh, I'll give him ibuprofen 3 hours later. It doesn't work that way. It is true. Paracetamol and ibuprofen, if given, they can be given at the gap of 3 to 4 hours. If you're only giving paracetamol for fever management, you have to maintain at least 6 to 8 hours of gap. So let's treat fever the way it should be, as a beneficial host immune response, and let's not treat every fever. Thank you. I'll see you next week. Please make sure you share this video with all your other fun moms. That's all for today from Mom's Time. Bye-bye.